few years. Recognition for excellence spurs us on, affirms Rajesh Agrawal, Managing Director.
We are into the manufacturing of the veterinary products. Our name of the company is Ashish Life Science Private Limited, and it's been an honor to be recognized in this niche category of pharmaceuticals in the veterinary side.
We at Ashish Life Science are poised to grow manifold because of the trust our customers have placed in us. The company's primary strengths are a state-of-the-art manufacturing facility, premium and innovative products, an experienced team, and uncompromising quality.
So hope you have seen this video. So this video indicates that how Ashish is more keen for giving the value-added products to our customers. So this was a nutshell about our major R&D as well as our manufacturing unit. Now let's concentrate on ALS in Zambia. See, ALS is very strongly present in Zambia since more than 10 years. Also, we have one veterinarian who is working in the field, who is working for ALS exclusively. Also, we have one country manager who is based in Zambia. And certainly, Ashish Life Science is associated with Lusaka Agrovet while doing business in Zambia. So they are our channel partners who are importing our drugs there, and they are supplying for benefit of the farmers as well as the veterinarians also. So this was about the Ashish Life Science. Now let's go to our discussion that when we are going to discuss anything to our farmers or when we visit a farm, so what are generally common problems what the farmers say, and all their problems move around the profitability, isn't it? So the first thing what they will come to know that there are few fundamentals that we all are aware that they needs to be followed as far as when the dairy farm is concerned. Or this fundamental holds true with any of the farm. The first most important is deworming. Deworming is must. We all are professionals over here. We know that what is the importance of deworming. So how that will be beneficial for improving the farm profitability. And second, the most important aspect is whatever we are feeding to the animal, how that will be utilized by that animal or the bird for their well-being, as far as their body health is concerned or their regular health is concerned, for the maintenance, their growth, as well as the productivity of the animal. So for that, digestion needs to be improved or it to be proper or at optimal level, so that whatever we are feeding to them, it should get utilized properly, isn't it? So now let's focus on that. That what fundamentals we will have to follow. So first, as we discussed, was deworming. So certainly there are various factors also which governs the profitability, as you can see in the slides, the parasites. If parasites are more or the worms are more in the animal's body, so certainly they fight for the nutrition, they challenge the immunity also. Next most important is we discuss that improper digestion of the feed, and that is one of the reason where we will see most of the time our farmers complains to us. We are giving the best feed to our animal, but still the productivity is not at maximum level. Still my animals are feeling falling ill frequently. So because the nutrition get challenged, and that's why the immunity is at a toss. Then reduced immunity because of this, of the nutrition supply, and certainly the control of hemoprotozoa. So these are various important factors which also to be taken care, but majorly it moves around the parasites as well as the digestion, because then the two rest of the points are the parallel points to it. Now let's understand that the prevalence of parasites. We all know majority of the animals they go for grazing, or evenly if they are stall fed also, the adjoining animals are there. So if one animal is suffering from parasitic infestation, it may pass it to another animal. So, and it is there is one reference which shows that more than 70% of livestock they are infested with one or other parasite. So that's why deworming is very, very, very important. We know that it has its own merits, that why deworming has to be proper, and that's why in many of the farms, deworming is judiciously followed. Then let's see that with some of the ectoparasites. This is just for our, brushing of our knowledge. We say that there are the mites, fly sometimes, and then lice, and last but not the least, the tick. Now, these all are important for taking care of a farm's profitability. Why? Because they are the vectors for majority of the disease. We will see in our upcoming slides. See, then what are various methods that we take care to get rid of this? People are going for dipping methods, spraying, some external applications they use to get rid of the ectoparasites. Evenly, some pour-ons nowadays in the markets are there, and some injections also, like ivermectin, people are using for getting rid of this parasite, especially the ectoparasites I'm talking about. So these are various methods which they follow for getting rid of the ectoparasites. Now, these ectoparasites, we all know they cause this nuisance, and because of that, there is irritation to the animal. And because of this irritation, certainly there is some disturbance to the animal, and that's why the physiology gets disturbed, and that's why the productivity has to be hampered. As we see the direct loss, so there is a damage directly to the skin, and you will find that if that particular farm is a farm which is related for the fattening of animals, so there if the animal skin is not proper, or the skin is damaged skin, so you know that the value of that meat will get rejected, or that animal is get rejected for slaughtering. Evenly, because of this ectoparasite, there is loss of blood, and once there is loss of blood, there is anemia, and as anemia imparts various uh, other diseases also, because the immunity also gets challenged. There are some skin lesions. We were seeing that these scars are there, as you can see very clearly in the picture. And the most important is they transmit protozoa. They act as a carrier for various diseases. Evenly, the feces are also one of the things that the parasites stick on the hide of the animal. So overall, what happens that they are carrying their own disadvantages, which are at the urge of profitability of the dairy farm. These are very small things, but it plays very, very important or very crucial role, I must say, for the farm profitability. Now let's understand about the which are the internal parasites, or we say the endoparasites. We all know there are three important endoparasites. The first one is roundworm, tapeworm, and flatworm. Like in technically, we call them roundworms for the nematodes, tapeworms as the cystodes, and flatworms that is trematodes. So these are to be taken care. We all know that they have, again, their main thing is that, as we can see here, they have the direct and indirect losses also, where we will just see that direct losses, that the animal suffers from diarrhea, there is reduced feed intake, and certainly they sucks the blood, so that's why anemia will be there. And if it is a growing animal, so certainly one of the important nutrient for growth of animal is protein, so that protein get lost, and because of that there is a stunted growth. And because of that, if nutrition is not proper, many of the times as a direct loss, we will see that the reproductive performances why get reduced. Why? Because the we all know for reproductive trait, the most important is hormone, especially in case of females, for estrus induction and also to maintain the pregnancy. For estrus cycle, we know that estrogen plays very important role, and for maintenance of pregnancy, we need progesterone. So both hormones will get challenged. Why? Because the nutrition especially the minerals, they will be at top. And because of that, because they act as cofactors for various metabolic activities as well as for the hormone synthesis. So that's why the animals will not attain puberty also. Majority of the time, the animal's reproductive organ will not get developed properly. And that's why farmers always complain us, oh, see, the animal has, the age is there, but the animal has not, or the heifer has not shown any sign of heat. There might be chances of frequent abortions also. Maybe we always take care of, oh, it might be because of only the brucella, or it might be because of some other things. But a simple reason might be there, that there might be the nutritional deficiencies because the fetus is not growing because it is challenged, or it is challenged for the nutrition with the parasites. Then dullness always will be there. Abdominal pain always we will find. Certainly, there is a loss of production, that the milk productivity also is get down. Then reproductive performance, as we have discussed again, and the most important is immunosuppression. And this is one of the factor where we have to guide, and obviously many of us might be guiding to our farmers that regular deworming is most important and one of the key steps for successful dairy farming. Let's concentrate on indirect losses also, as we all aware that the contamination of pasture and fodder due to animal excreta is always there. So it causes the risk for infestation to the other animals. Then the decreased carcass value we will get, susceptibility for any other bacterial and viral diseases because of the challenged immunity. So these are the indirect losses also what we get, and we always listen this from the farmers also. So these are few of the slides which can directly show that these are the, fecal examinations. The first slide we shows that there are some worms of the eggs from nematodes, the round worms. Then again, the below picture is explaining about the intestinal worm, that is Trichostrongylus, Trichoris. So these are few of the examples that how they look like just for their morphology. We all know that what is that their life cycle. So it's very crucial to select. Why I'm discussing about life cycle? Because it is very crucial to determine that which product we should use. Because if you see the literature, few products they act on the eggs, few products they act on the larval stage. So that's why it is very crucial that what and evenly how many times the cycle of deworming has to be repeated. So this is the reason why we always should learn, or we should be keen about the life cycle of the parasite. Certainly, it is very difficult to judge that what kind of life cycle the parasite might be going through. So that's why fecal examination is most important. But at the field level, fecal examination most of the time will not be possible. Why? Because the tools are not available. So we have to go by our gut feeling as well as the experience as well as the signs and symptoms which are exhibited by the animals. Now the roundworms, we all know which are the predisposing factors like the malnutrition, low immunity, evenly the hygiene of the farm. And we know that, as we have already discussed, that how they get exposed during the grazing, especially here for the roundworms, the nematodes, the older carrier cattle is always as a toss. So that's why deworming at a time to all the animals in the farm is required. One more important aspect, that if the farm has other species of animals, like they one farm is there, they might be having some pigs, they might be having some birds. So it is equally recommended that all these species also to be dewormed in one go, right? And we all know that how these parasites they damage the host, like they causes anemia. First thing is retarded growth. Occasionally there is a death. Why? Because of the if it is unnoticed or it is non-treated, then because of the severe anemia, it may occur, but it is very rare because immediately people start giving the medication. Then adult cat may harbor the low number of worms and show no signs of ill health. So that's why we have to again follow. Means only the fecal examination sometimes may not reveal. or even the science may not reveal, but we have to follow the practice, or we have to recommend the practice of deworming, especially in dairy cattle. The disease is more common in cows, especially the this. It's not a disease, but this infestation is very much common in case of the cow, which are having within the age range of 3 to 6 months, because their immunity is very less. So immediately they will get infested. Tapeworms, we all know, even the tapeworms are of, you know, zoonotic importance also, because most of the time the same species we can find in humans as well as in animals also. And we all aware that the Monienzia, evenly the Tania, these are the common genus which are very much found in cattle as well as in sheep, goats, as well as in human beings also. So this is what is one of the photograph which shows that, see how this tapeworms are very dangerous, because if you see this one fragment, it has thousands of eggs, and which are equally hazardous for human being also. So that's why we have to take care when the tapeworm is there. So certainly we have to be very cautious while treating that animal or the farm. Why? Because this tapeworm may be there, maybe in the human beings also. So that's why this is of a zoonotic importance. So we have to take care of this infestation judiciously. Now we were looking about the ectoparasites, that they are on the animal's outer side of the body. They are on the skin, or sometimes in the hair. So these are the common problems that we find, that what ectoparasites gives to the animals, like animal scratches sometimes. There might be alopecia at that area, the area. There might be allergic reactions because of lot of histamine secretions might be there. Then spread of the disease also will be there, and there might be chances of death of the animal. And once there is open wound or cut is there, so there are chances of secondary bacterial infections also. And that's why there will be sometimes we find the pus also in that. So we have to give antimicrobials also. This is just a simple external parasite, but it may cause a death of the animal. Then these are the morphological things. What we can see, these are the fleas, as you can see in this one, but which is very common in dogs and cats. Sometimes we may also find on the animal body also. Their major thing is that they are having, special legs, and they have the special ability to jump for a long distance. So from one animal to another animal, they jump very quickly. So that is their beauty. So that's why it is again recommended that whenever you are either you are deworming or you are using anything for external parasites or internal parasites, it should be followed at one go to all the animals which are there in the farm, including all the species. Okay, then again they have the blood suckers. Here one point is mentioning to that they causes the allergic dermatitis. They always cause allergic dermatitis. And certainly, as all are the blood suckers, so anemia has to be there. Okay. And the most important thing you will find at the bottom, that fleas, they are the intermediate host for tapeworms also. So whenever you find fleas, tapeworm infestations might be there in that farm also. Okay. So signs again, it will be the same, that we may find there dirt, baldness, or you can say the alopecia, itching, and everything will be there. So here one point you might have seen that when you examine the animal, the flea dirt is mainly dried blood. So if you see some of piece of the, so you can just take, wet cotton, and it will get dissolved. So that you have to, when you are visiting a farm, or any customer is coming to you, or the if animal is coming to you, or you are visiting to that particular farm, you are consulting to that farm. So it is very important to examine the animal, that against the hair, you have to move your hairs, your hand, that the grooming practices, and that's why you have to see if you find any kind of that the bright blood spots there or not, or any kind of itchiness is there, or baldness is there, or any bald patch, small alopecia might be there, few skin lesions also you will find. So these are the common points which to be observed on the daily basis. So this is just again the life cycle of fleas. I'm not going to discuss about life cycle because we all are professionals sitting over here. Again, lice is again one of the important factor. Even in case of human being, lice is very important. Uh, so we all know again the itching is one of the important things. But here the point to be noted is that certainly they don't have wings. Uh, they are not, but they are not at all what you say that much visible as far as fleas and all are concerned. So lice, again, you need to be very cautious because their eggs plays very important role. Because once their eggs are there, because they have ability to stuck into the air, into the hairs. So it is very difficult to pluck them out. And most of the times, the hair color and the eggs colors is nearly matching. So that's why it goes very difficult to identify them. And because of their tiny small sizes, it's goes very difficult to get rid of them. And their suckers are also very strong. So this is what is you can see again the same thing evenly, especially in when lice is there, then you will find some skin also get erode. So we generally call that is dandruff. So there you will find some dandruff also when there is especially the lice are there. Then everybody knows ticks. Ticks certainly relate to spiders, but certainly spider has a very light weight and they are very delicate than this ticks. But they are, similar to spiders, but they are not exactly spiders. So we all know that there are hard ticks and soft ticks, but see certainly this is the common again observations everybody might have observed that when we see the tick, it might be a small size, but when the tick had his lunch or dinner, that is the blood from the animal, you will find it may have increased the size. And you will see the typical, the head is too small, but the rest of the body, especially the stomach, is too large or too uh, bigger than their rest of the organs. So they swell up to 100 times to their original size. So this will indicate that how they can suck the blood. Okay, so they have the higher capacity to suck the blood. Then again, mites are there. We will find that you can see here in these images, and certainly again that is of a zoonotic importance that there might be the sarcoptes are there, but these are again specially for the dogs and cats also. But certainly we may find sometimes in case of large animal also when dogs and cats are also available in the farms. Then this is again a main, we will find that again typically in dogs also we will find mostly in dogs, especially the belly area, or especially where the elbow joints is there, or under the elbow, this armpits, evenly the ears, the inside ear pinna, we will find that this kind of readiness will be there, redness will be there, and it is profusely itching. It gives also a bad odor because of the secondary bacterial complications, and their pus formation will be there. So these are very important aspect while we are going to the farm and we will see that the rest of the animals are there or other species which are there in the farm. We have to analyze that also because sometimes they act as a vector or they act as a carrier also. Okay. Now myiasis is very again a common term which is generally used for the flies. So we know the fly in the life cycle, they lay thousands of eggs, which goes into the animals, which are in the animal's body or especially in the wound, and they get converted. Once the eggs hatch, the larvae comes out. Now, what exactly this larvae will do? This what happens exactly in meiosis? We all aware that especially these larvae, they fed themselves on the dead tissues. So if there is any open wound to the animal, so that wound is okay to treat. But once the fly control will not be there, the fly leg eggs there, eggs hatches and larva comes out. So they eat all the dead tissues which are there on the in the wound or surrounding area, and that's why usually that wound becomes complicated. Why? Because that wound get converted into deep-seated maggoted wound, and that's why the first phenomena we know that for wound healing is that closure of the gap should be there. So because of the larva, that gap will not be the wound gap, it will not get closed. And that's why first thing what we as a technical person, we as a veterinary medical team, we have to do is to take care of that larva. And that's why we have to, it is very important that the fly control has to be done in the farm. Also, they carry other diseases also. So that's why we have to be very cautious that if any wound also is there, of if wound also is not there also, fly control is must because it causes nuisance. Because we also get sometimes disturbed by any other sources. So we may lose our focus. And that is one of the reason why the physiology get hampered, right? Then certainly need of our is. We know all these practices we are following or evenly the farmers might be following under your guidance. We specially recommend for external parasites. If you see the literature also of ivermectin, it is also recommended that yeah, it's very good broad spectrum dewormer. It also has a action on the internal parasites also. But usually there is one preference that for external parasites, ivermectin we are using, and especially for internal parasites, the wonder drug is there that is albendazole, which we are using. So we as Ashish, what we thought, let's go because see, especially for that is major difference for animals and human beings. That in animals, we have to first restrain the animal, whether it is for any examination or it is for the drenching of any medication. So giving medication is again or giving feeding anything to the animal, especially the medicine, the bolus form is very difficult, or evenly to administer the drench or to give drenching to any medicine. It is also a difficult task. So giving two different medications is again a challenge. So we, Ashish, we thought because we have shown in our video, audio visual corporate video that our R&D is there. So what we thought, can we combine these two drugs so that it will be having a summation effect? Usually mathematically 1 plus 1 is 2, but can we get that 1 plus 1 equals 11? That ivermectin as well as albendazole, both are broad spectrum. Both have action on external as well as internal parasites. So can we combine both of the drugs and to get a better result as far as the efficacy is concerned and administration is also concerned? So we have albectin bolus with us. Hope you might have used this also. So we have albectin bolus, which is exclusively designed for. There are two important aspects into it. Being a veterinarian, or evenly for the farmers, it should be very easy for drenching because the first thing what I'm a veterinary pharmacologist, so we also say that drugs are very important. But the first thing is that the drug should be commonly available and it should be easy for administration. So if I am saying it is very difficult for administration, so it will be a trouble. So that's why to make ease, we have combined two different drugs to take care about external as well as the internal parasite. So we have a unique drug or unique product that is albectin in a bolus form. Okay. Now let's go into the important aspect that how they act. So we all know just a quick recap of this one, or recap why I'm saying because you all are professionals here. So we know albendazole specially acts on the carbohydrate metabolism. So it works in a two way. First thing that it interferes with the carbohydrate metabolism of the parasites, and another thing they hamper their glucose absorption. So ultimately, there will not be any energy to the parasites. And that's why they starve and there is a death. Now let's concentrate on ivermectin. Ivermectin is a very unique product which especially on the arthropods, it has action that it causes hyperpolarization. And because of hyperpolarization, there is nerve and muscle get damaged. There is hyperpolarization. There is a paralysis, and because of that, death of the parasites occurs. They because parasites, usually the external parasites I'm talking about, they have the suckers. So to hold the skin, their muscles has to be very strong, and ivermectin especially paralyzes their nerves, and that's why their muscles also, so that their grip will be, will not be firm, and that's why they've fallen down. But most of the time, we have to recommend to our farmers, if especially that they are tying their animals into particular area, so that area also needs to be cleaned properly. Because why these external parasites have a tendency, if they are fallen down from the animal's body, they hide into cracks and crevices. And that's why most of the times farmers comes to us, yeah sir, there were parasites, and then you have given the medicines, you recommended me the medicines, I have given few days it was good, but after I can see, after 15 days, 20 days, or maybe 1 month, sir, again the same problem is there. It is because of this, that they may not clean that particular area properly, or else there might be chances that they have only dewormed one animal, not the other, or else they might be having other species in their farm which they have not dewormed. And that's why it is a very small aspect, but it causes a huge loss to the animals. So I hope you all aware about our albectin, and you will keep supporting our albectin. So a single dose solution, especially for ecto as well as for entoparasite. And the beauty of the product is that only one bolus is sufficient, near about for 300 to 400 kg body weight. Only single bolus. This is a single bolus treatment. So this is a very well efficacious drug. This albectin is available in most of the countries, and we are receiving a very tremendous response for albectin. So we are expecting the same thing, that we will get it also from Zambia. We all know one important aspect is there, that the strategic deworming program means every 3 months, everybody or all the farms, especially the high yielders, whether it is a beef farm or whether it is a dairy farm, every 3 months they have to deworm. Okay, so evenly parasitic diarrhea also will be there. And in my earlier slide, we said that in the animals which are age-old animals, they may not show any signs or symptoms also. And that's why we have to, every 3 months, we have to carry out the deworming. Evenly, the most important thing, immediately after parturition, we are also recommending, in our books also we have read that before artificial insemination also we can deworm. Before any vaccination, deworming is important or recommended. Before you change of any season, deworming is very important. Because of you, if you are changing the feed also, that time also deworming is very much recommended. So this is how deworming is a very small aspect, but it carries a huge plethora of benefits to the animals. And if animal is benefited, certainly the farmer get benefit of it. The most important aspect, the follow-up of enterohepatic circulation. Our albectin, it follows the enterohepatic circulation. So that what happens, so that whatever parasites they are into the enterohepatic tract, it also get, thrown out of the body. And here I want to highlight one important point. We all know that albendazole. But guys, let me tell you one thing. It is very important to know albendazole is also safe in pregnancy. The dose has to be followed judiciously. It is very well recommended that albendazole also you can use in pregnant animals. Certainly, you have to analyze the stage of pregnancy as well as what is the exact dose depending on the body weight of the animal. And last but not the least point, that albendazole is effective in all stages of parasites. In my earlier slides, we were discussing about Certain drugs are, active on parasites. Certain drugs only acts on the larval stage. So how to judge that? So that's why the deworming cycle has to be for 3 months. And the most important thing is that we have to choose a drug judiciously, which acts on all the life stages of the parasite. Because by naked eyes, we cannot say, oh, this parasite might be in the larval stage, this might be on the egg stage. It is difficult to comment on that. And at the field level, it's more difficult. So that's how we have to use our technical capability as well as the signs and symptoms what animal is exhibiting, and the history that we take, the anamnesis from the uh, farm owner or farm attendant. So this I was discussing that a single dose is sufficient for 300, single bolus is sufficient for 300 to 400 kg body weight. So looking forward for your support for albectin. Now, again, if we say about the internal parasites again, or the worms, so they also cause great hazards. We have discussed already. Then, especially to understand their life cycle is very important as far as if we are trying to have a strategic deworming program to reduce or to control the worm load. So we will discuss again important aspect that uh, how they get regularly infested. Certainly, one important is the grazing, the common grazing. Second most important is the animal which are there in the farms. Then the contaminated fields. Evenly, the animal ingests the harmful parasites or worms, especially during the grazing only. Most of the times it happens. But if the animal is stall fed, then all the animals, all the surrounding animals, also to be judiciously dewormed. The dung should be cleaned properly or immediately, I should say. There should be a proper sun. We should come in the passage of urine where there will not be growth of bacteria also. So that's how, when we learned about our livestock management, where they taught us that what kind of orientation of a dairy farm has to be there, whether it should be head to head or tail to tail. So these are the basic reasons what we also have to impart this knowledge to the field people, or to the farmers, so that they can, these are very small things again, but it will benefit them with the larger benefits uh, for the farm profitability. So we have one important product, that is Nilja Shear Sport. You might have heard about this product. Now again, as we were talking about the dual benefit, now there might be some areas where water stagnation conditions might be there. Or else, whenever there is a rainy season, we find one common thing, that is the snail. And snail is again one important, I cannot say parasite, but important mollusca category, which is very important for transmission of one parasite, that is liver fluke. So we have one product which, that is Nilja S4. It is certainly into the suspension form. Nilja S4 is a unique product which takes care about roundworms as well as the flukes. So the area which is infested with the your snail. So there are chances that when you are visiting a farm, you have to, if you are just taking a walk on in the farm and you will find some snails, so there are chances that there might be liver fluke infestations. And many of the times people have registered that when they do postmortem, they find majority of the flukes. So we have one unique product, that is Nilja Shear Sport, which helps for the strategic deworming program. So we will discuss that what exactly is that strategic deworming. So again, if we will see the mechanism of action, the flukicidal, that is oxychlorocinide, which we have in Nilja Shear Sport, so uh, it uncouples the oxidative phosphorylation, so that again the energy utilization has to be hampered, and because of that the flukes, they die there. And levamisole, which acts as on the uh, roundworms. So it causes the, especially the acetylcholine receptors are there. So it causes continuous stimulation of that, and because of that, there will be again a paralysis of that worms, and they get rid via the dung. So we all know that Nilja Sport, I will just show Nilja Sport is very commonly used, especially to treat the flukes as well as the worms. So whenever you find any dairy farm or you are consulting to any farm, or especially before rainy season and after rainy season, we always recommend that the dewormers what we should use is Niljash S4. Why? Because during that time only the liver fluke infestations we will find more. Evenly there are few areas where water stagnancy condition is more. There muddy lands are there. So there also snail population might be more. So that time also in those surrounding areas, we have to use the product like Nilja Sport, right? And you can see the dose is very simple, just 2.5 ml for 10 kg body weight for cattle. And evenly you can recommend Nilja Sport very well in the goat farms or sheep farms you have. Just 0.5 ml for 2 kg, only zero point 0.5 for 2 kg body weight. These are the suspension form. Now we have Niljas also in bolus form also. So this is also in Nilja. Our Niljash is also in bolus form. We have seen our Niljash this S-port in a suspension form. We have Niljash in bolus form also. So whenever there might be some preferences that people, there are few areas that people only prefer bolus only, or they recommend, oh, okay, give me bolus. So fine, you can recommend our Niljash, which is there. It is also available in Zambia. So you can very well use of this drug. Again, it has the same composition is there, and just again only simple one bolus for 150 kg body weight. So very unique product. So I request all of you again, whenever is possible, you can recommend Niljash Sport suspension or Niljash bolus, depending on the practices which are there in the followed in the farm. See, this is the point which I wanted to show to you. Certainly, as there is the, we always recommend what kind of medicines to be used when we have a choices that whether there is uh, what kind of bacteria is there. If gram positive bacteria is there, we have like penicillin kind of drug. If we have gram negative, then we can go for streptomycin, or sometimes we go for broad spectrum antibiotic where we have a dilemma or we don't have chances to do the antibiotic sensitivity test or culture test. So certainly deworming is also very important, that as per the season, as per the need, as per the body condition of the animal, we have to judiciously choose our dewormer. Like especially for the dry season, we can take help of our drugs like albendazole, like our ashwelben, as well as our albectin kind of drug. But when there is a wet season, then we have choices for Niljash S4 and Niljash bolus also. So these are the seasonal wise drugs you can recommend, especially for benefit of the farmers, because this will help to get rid of the exact parasitic load. Okay, so I recommend. So you can recommend. I request all of you. So whenever you are recommending to any dairy farm, so please select. Certainly you might be following, but please again give an emphasis on the drug and the deworming pattern and deworming practices, that how oftenly they are deworming, because very important aspect what people usually don't deworm most frequently. And as a part of strategic deworming program, it has to be repeated every after 3 months, depending on the challenges in the farm. Here is one trial which I want to show to all of you, which shows, see, this is the trial. Now I'm just clicking on the link of that trial, and the trial report will be there. That you only will see this trial. I will just read the interference, that This is the trial which is in one of the country, and it shows that impact of deworming on milk production, and evenly not only the milk production but also the milk quality, that they have found that the milk percent also has been improved, as well as the quality of the milk, like the fat and snf, it the both are improved when they deworm continuously the animals, not continuously, the on the regular interval. So once they did this, they got a good result. So this is already available on the internet. So I just wanted to share with you. This reference is from internet only, which is very commonly used. Okay. So this is a very important aspect, that merely deworming can improve the productivity. Evenly, you will find that once deworming is there, regular deworming practices are there. So that time the animals will not fall frequently ill. Evenly, you will find the productivity also will be improved, and especially the skin coat of the animal also get improved. Okay. Now let's move to our next session, which is the hemoprotozoal infection. We always see the hemoprotozoa, they are being carried by, the vectors. Now let's understand. Again, this is a brushing up session. So we know trypanosomiasis, commonly named as SARA, and the carrier is nothing but the fly, which is generally the tabanus or stomoxy. The most important symptom what we always will find is the intermittent fever. The fever will be there, and sometimes it will go off. So sometimes again the animal, if you take the rectal temperature, you will find that yes, there is pyrexia. But again, after a few times, without of any medications, it will be fluctuating. But the most important thing which we find, that respiratory distress, salivation will be there, lacrimation, and evenly the nasal discharge is there. Most of the time, it get complicated, or it get not complicated, but it get diagnosed as a respiratory problem. So we have to again be judiciously taking care of the blood examination. Also check out the anemia also, and certainly the edematous swelling if anywhere is there. And the most important sign, that the circling movement. But certainly circling movement we will find when there is very severe condition. But these are the small things where evenly the petechial hemorrhages on the mucous membranes, we have to follow it up. So if we will see all these are the reasons, all these signs and symptoms, then we may give a thought that yes, the case might suspect for the SARA. Especially we will find these around the monsoon season. Why? Because the fly population is certainly increased during that time. So that is one of the reason when we are visiting any farm or consulting to any farm. So if we see the fly, so fly control is very important for the farm profitability also. Then these are the blood smears, and you will find that this is a filamentous kind of there. These are again the uh, parasites, that is the trypanosoma. Here are the blood smears. These are the certainly extracellular. These are not inside the cell, but these are outside the cells. What you can find here. This is a blood smear, and this specially we have done the smearing with the Gimsat 10. Then we all know that to diagnose trypanosoma is again a very difficult thing as far as field level is concerned, if we don't have any diagnostic tools there. But certainly we have to see or observe few points, like there is a intermittent fever, circling movement, lacrimation, eyeball discoloration also is there, and certainly when we do the postmortem also, so that time also we have to see the liver condition, evenly the anemia, and certainly other biochemical parameters alterations we have to C. Then we have a unique product that is isometamedium. Chloride is there, and this is the salt name, and the product name you all might be aware, it is tripashish. So tripashish is now we have in 1 gram also, and but you will see that tripashish is very effective against all species of trypanosoma, whether it is congolens, or whether it is Evanzi, or whether it is Vivax. So against all these species, tripashish is very much effective. You might have used this product also. The beauty of the product is tripashish is very well recommended for prevention as well as for treatment also. So for curation as well as for prevention, for both the things, tripashish is very well recommended. And if you see the dose is very simple. See, just 12.5 ml for 250 kg body weight. It is a sachet. Tripashish is a sachet which has a powder for injection, which you have to dissolve into the distilled water or into the normal saline or whatever. If nothing is available, then we have to use. You have to just warm the water and then you have to. But try that you should use proper solvent to dissolve it. And for prevention, just 25 ml for 250 kg body weight. You have to double the dose for prevention. So we have a unique product. I just then again we have for especially for babesiosis also. We see that again babesia is again a tick-borne disease, and especially in babesia, we will find that there is high fever. And we know that again it's anemia, so mucous membranes will be pale. There is increase in the heart rate. But the most peculiar symptom we all observed in babesiosis is the presence of hemoglobin in urine, that is hemoglobin urea. So this is again a life cycle. Again, it's a tick-borne, so we have to take care of the ticks. Earlier slides we have discussed about the external parasites. Then these are the common symptoms that anorexia, high fever is very, very commonly seen in all the parasitic infestations and even the hemoprotozoal infections. Hemolysis and anemia is very, very severe. But here, the point to be noted is hemoglobin urea. Most of the times, people get confused this condition with post-parturient hemoglobin urea. So that time, people usually give the phosphorus only. But here, we have to be very judiciously use the product evenly. This is one of the reasons for abortion. People use whenever there is abortion, people think that it is because of brucella or because of any other thing. But again, this is one of the important factor to judge that whether my animal or whether the farm which I am consulting is suffering from the hemoprotozoal infections or not. Evenly, the babesiosis in the farm where there are only bulls are there, it have a temporary decrease in fertility. So evenly the semen quality also get hampered when there is a babesia. So this is what we can see that see now trypanosoma, we have seen that it was outside the cell, but here we have seen that the babesia is inside the cell. Okay. So for this, these are again common symptoms which I just try to enlist here: abortion, fever, terry-colored urine, immunosuppression, lymph node will be enlarged, reproductive failure will be there. Evenly, sometimes blood vision might be there, blood vision. And if it is untreated, certainly death of the animal has to be there. Then we have special product that is Moltrip 1050 over there. But here one thing what we added is again, it has Moltrip has phenazone, especially when we talk about the lymph node swelling. So we have to give non-steroidal anti-inflammatory drugs. So phenazone is there, which takes care about the fever and the swelling of lymph nodes and even the pain. You will see that administration, it's very simple, just You have to dissolve our 2.3 gram sachet into 15 ml of distilled water. And if you are using, you have larger farm, then 23.6 gram is also available, which to be dissolved in 150 ml of soil water. The dose of our Motrip is very simple, just 3.5 milligram for 1 kg body weight. So that's how you have to calculate the dosing. It will be very simple to calculate the dose. But here, one point I want to highlight: when there is a severe anemia, so because of this, certainly immunity is low, because cell will not be getting the proper nutrition. There will not be a proper hemopoietic system which is to be developed, and that's why there will not be the proper RBCs, and there are chances of death. So we have one special product, that is Moltrip Plus. This particular product, or Moltrip Plus, is enriched with vitamin B6 and B12, and the roles are here. So if you see our Moltrip, Moltrip is very important. Moltrip Plus is very important to use. Why? Because it has additional vitamin B6 and B12. We all know vitamin B6, especially, it is essential for hemoglobin synthesis. And we know vitamin B12 is generally labeled as cyanocobalamin. It has cobalt, which strengthen the immunity also of the animal. So both products are very important to fight against anemia as well as to enhance the immunity. So that's why Motrip Plus is very important product to be used in these case of the animals. And again, it helps to prevent anemia. So Motrip Plus is again a unique product where we should use. Now we see this tripashish. Okay, I want to show one important aspect that tripashish we have discussed. Tripashish is very important. I would like to highlight, see this. As in one of our important uh, corporate video, when I was starting the session, we have shown you our R&D, evenly our manufacturing plant. You see, this is totally mechanized. So it helps that how technically advanced things we as Ashish we are using, and that's why we have got various approvals, including WHO GMP, Australian, European GMPs. Our plants are approved by them because we are using, this is totally hygienic, sterile, and there is no intervention of any human being for packing. Now, I would like to highlight one important aspect here of our tripashish. I would like to just show you one small video of tripashish. See, this will show you how tripashish get well dissolved. Most of the times, what you dissolve into the soil water. See, I have taken just a tap water only. It is just a small water which I have taken there. You can see here. Just to take the benefit of time, I'm just moving ahead. Okay, so this is just a distilled water. Immediately that get dissolved. So I'm just adding the distilled water into it, and you will find that this the whole quantity it is getting dissolved. So this shows that how, you know, superior quality we are giving it to our clients, just for benefit of the farmer. See, here again we are giving a very important, because in market there are Me Too products are very commonly available. So this is again a tamper-proof seal we are giving as a quality standards to maintain. So you can use our tripashish. Now, I would like to highlight one important point that when we were discussing about the fundamentals, it was revolving around two important points. First was deworming and certainly to take care of the internal, external parasites and hemoprotozoa. But the next was the digestion, right? Now, how we can do that? We all know this is the digestive system. I'm just going to the digestive system. We know that it starts from the mouth, esophagus, and every part has its own role. But here the main important part is the stomach, and we all know the ruminant stomach is divided into four parts: rumen, reticulum, omasum, abomasum. Every part has its own function to perform. We know that the majorly why ruminants are called as ruminants, because they ruminate, and because of they ruminate, and they have rumen. So that's why the ruminants are there. So this is the largest, rumen is the largest part of the stomach. We all are aware, and it has a special thing that it has microflora, and the digestion in ruminant majorly occurs by the ruminal microflora. So it is a microbial digestion occurs there. So rumen has its own advantages. It has a specific pH, it has a moisture, it has anaerobic condition, and it needs a supply of nutrients. Why? Because the bacteria has to be grow there. Okay. Then reticulum, we know that it's honeycomb-like structure, especially it acts as a filter. Omasum has a multiple folds. It squeezes, especially to uh, separate the liquid part and the solid part. And we know abomasum, which is a true stomach, because it is a glandular stomach. It has a glands which secretes the gastric juices. So we know all these about these things. Again, like the small intestine and large intestine, they have the major role into enzyme secretion as well as the uh, new absorption of the nutrients is concerned. And large intestine, it majorly also absorbs, but it helps for throwing out the undigested part as a dung. But here the most point to consider is that as we were discussing that the digestion in ruminant is microbial, and it helps for absorption of volatile fatty acid, acetic acid, butyric acid, and propionic acid, and also the water. There is also synthesis of B complex. Animal doesn't require B complex like us, like human beings or any monogastric animal, because the microflora they synthesize their own B complex. Also, it helps for the detoxification. Certainly, detoxification is major role for liver, but microflora also helps, and rumination is very important part which they have to perform. Now, here the one point has to be there, that why digestion has to be important. Like I'm just going to these things, that we always find that ruminal pH is always at disturbed, and we will find, if you observe the dung of the animal, you will see that the undigested or sometimes the feed materials also you will find in the dung. Ultimately, what happens, because if you see here, the digestion part majorly revolves by the ruminal microflora. Evenly, the carbohydrate digestion is not proper. It reduced volatile fatty acids, which are very important for milk fat as well as milk protein is concerned. Correct? Evenly, the protein digestion also will get hampered. Why? Because protein digestion is very important for growth, because protein has amino acids, and that's how the animal always suffers from one or other problem. Because if there is rumen degradable protein and rumen undegradable or non-degradable protein, if they are more, so animals suffer. Because of that, it will not get absorbed properly, and because of that, the rumen ecology disturbs. And because of that, we will find that the animal again becomes off feed. Animal will not be able to digest the feed material, and ultimately again animal becomes weak, and there is again chances of infections because of the challenged immunity. And because of this, we have to take care of ruminal ecology. And for this, we have a special product which takes care about the stabilized rumen, which improves the volatile fatty acid secretion, and as a result, there will be high milk yield, or the milk yield will be enhanced, as well as the fat percentage also will be at maximum level. Let's understand one more important aspect, that when there is the anorexia, there are two things. One is primary and another one is secondary. So let's first focus why there is anorexia. That when we feed low fiber diet, or evenly when there is a change in the feed, or evenly the concentrates might be fed more. So that time the fiber degradation of the degrading bacteria, their population get reduced, because rumen ecology get hampers, and because of that indigestion occurs, and that's why there is anorexia. Evenly you will find that when there is a why secondary, because when infection is there, we always use antimicrobials, and these antimicrobials, they hampers the bacterial growth, whether it is useful bacteria or harmful bacteria. And that's how we will find that after prolonged use or after medication with antibiotic, you will find our farmers come and they complain, sir, animal is cured, but now animal is not eating properly. And that's why we usually give them some of the rumen stimulant and even the B complex externally. And this is one of the reason where they get anorexia. And that's why we have to treat our animals with a specific product, which is which helps them to increase the microbial, rumen microbial, which decreases the load of harmful bacteria, and they maintain the rumen environment. And that's how we have one unique product, that is Milky Way bolus, which is very important product to maintain the rumen ecology, to decrease the harmful bacterial load, and to bring back the animal to the productivity. And that's how the digestion will get improved. So Milky Way bolus is one of the unique product, which whenever you find that animal is ill, you have to feed that animal first with the Milky Way bolus. Why? Because it reduces the convalescence period. If animal is not eating properly, or animal is eating but it is not getting digested properly because of the hampered ruminal microflora, then we have to give Milky Way bolus. And certainly it also our Milky Way bolus, it maintains the integrity of cell membrane, and that's how the health will be proper. Milky Way bolus not only increases the milk yield, but also the milk protein and fat. But Milky Way bolus is a key factor for better immunity, for improving the appetite, and certainly the digestion. So this is how Milky Way bolus helps, because Milky Way bolus has Bacillus subtilis, Aspergillus oryzae, Saccharomyces cerevisiae, as well as Saccharomyces boulardii, which maintains and restore the ruminal microflora. Saccharomyces cerevisiae is, it helps for the proper fermentation. Bacillus subtilis for the digestion of proteins and amino acids, and Aspergillus oryzae helps for again the digestion of protein, or it produces some enzymes which helps for the digestion of protein. So this is how overall the digestion will get improved. Now we are a technical people, we always say that we should see some results, right? So certainly we know that it will be economical to use Milky Way bolus. Why? Because the convalescence period will be reduced, and that's why animal will be back to the production a bit quickly. Faster rejuvenating power is there with the Milky Way bolus. And the most important natural way to correct digestion is Milky Way bolus. Now, I want to show you one more report, which is carried out in Ethiopia, one of the African country, which directly we have seen that the Milky Way bolus name is there, Milky Way bolus. So these are the trials which are carried out in the Havasa University in Ethiopia, the veterinary university, where they have shown that after giving Milky Way bolus, there was increase in the milk production, as well as the parallel benefits, like animal was healthy, the skin coat also was good, and evenly the animals' overall health was significantly improved. So that's why this is a tested efficacy which we want to share with you. And certainly you might have used our Milky Way bolus, and you can also help us with some of the reports of Milky Way bolus. So I request again all of you. These are the very simple basic things, but it improves the farm profitability at maximum level. So it is our prime duty again to guide our farmers technically as well as with scientifically for choosing the correct dewormer, for correcting the what you say, the indigestion issues, or evenly to whatever they are feeding to the animal, it should get properly utilized by the animal, by the body, whether in form of their regular activity as well as the productivity also. So I hope you enjoyed this session. So certainly I will discuss. I will see the question and answer session, and we will discuss again on these products continuously. So thank you so much for your time that you have shown for Ashish Life Science and this value added webinar. We will continue to do this kind of webinars again and again. Certainly, this was exclusive webinar for Zambia, and we will continue. So thank you so much for your time. Thank you so much and thank you so much for trusting Ashish Life Science and our unique brands. So soon we will start the question and answer session. So there are a few questions. Okay. Hope you will share the presentation. Okay. Fine. Okay. Rafael is there. Rafael has asked, are the bowlers coming with applicators? Oh, sorry, Rafael, because most of the times the applicator is being used by technical people only. But here, if you are recommending a product and this product, farmers, they go to the pharmacy and they take this, or the agrovet shop and they take this. So it's very difficult for them also to use the applicator. So we have to, this boluses or this boli, they can just mix into the bread, or they may dissolve into the water or in any kind of dough, and they can give it to them. So that's why they are not with the applicator as of now. Okay, so any questions, please write in question and answer there. So I would love to answer. Sorry, I got one message from one of my colleagues that the videos are not visible. So video